all mental unhealth can be defined as a regulation dysfunction of some kind. Depression, anxiety, all of it is that. And a fundamental contributing factor to that dysregulation is the failure of effective relationship. Why is it that rates of depression and anxiety and all the rest are skyrocketing? It is not actually because people are more inclined to report if they're having those symptoms. And it is not lack of access to treatment. The reason we see every new generation of adolescents initiated into a lifelong cohort of mental unhealth is because there is a failure of relationship. The purpose of relationship is affect regulation. It does, and relationship does this by way of the chief regulator in the brain, which, don't let any neuroscientist tell you it's the left dorsolateral prefrontal cortex. It's the right orbitofrontal prefrontal cortex, okay? And that has everything to do with relationship, because we are a social grouping species. And when you take a member of a social grouping species and isolate them, they cannot regulate. So anxiety, depression, all the rest. Look at the role of brain metabolics disruption with inputs to the system like diet and air and all the rest. Look at neuroinflammation. Look at chronic stress activation. But the main driver for the neuroinflammation and chronic stress activation, neurokindling cycles, is relational dysfunction. This is why dysfunctional relationships will dysregulate us and move us towards dysfunctionality more than anything else. And this is also why healthy relationship, integrative relationship heals us. That's actually what most therapists do. And it's not even a direct aim. It happens incidentally to the project of helping people to find greater insight in therapy. Development of insight alone doesn't move the dial. It doesn't. Not really. It's the therapeutic alliance between that therapist and that client. It doesn't have to be therapists who do this for us. What did we do before therapists? We had each other. And there's no therapist who's good enough to be able to fully outsource, like solo source, our need for a healthy relationship. We've got to learn how to come back together again. Okay? None of these pacifiers will do that we're looking to meet the need. It has to be this. In-person, dynamic, reciprocal. So, if we don't figure that out, we damn every generation of humans who comes after us. No other solution will work. No prescription medication, no advanced technique of psychotherapy, relationship. There's also addressing the hardware dysfunction problems that I mentioned earlier. So what we got to do? Get rid of the DSM. It's superstition. It's the Greek medical theory of humors is what the DSM is. Throw it out. We need something based in empirical science. Either that or we all continue suffering and dying. So